I want to share one experience and one story if the time permits. Let me run fast. So quality is endorsed by NABH once in 18 months, but it is endorsed by patients every moment. So if we put it in a mathematical formula, it is perception minus expectation. As the expectations increase and the perception decreases, the wow factor decreases. If we have the perception, the experience is more than the expectation, of course the patient will be delighted. But what do really patients perceive about a hospital? A study was conducted in US and where the patients were asked to compare a hospital to a car and hospital to an animal. So Rolls-Royce was compared to a hospital, not because it's a beautiful car, but it was unaffordable. Even if you had money, it is not easy to buy Rolls-Royce. And when it came to animals, the number one was grizzly bear. I don't want to tell the reason. The second is elephant because of its complicated processes going from one counter to another counter to another counter. Then leech, again no comments. But only good thing is it was not done in India. India maybe it would have been a pet dog or a rabbit or a deer, we don't know. What is difference about expectations of a patient when they go to a hotel and a hospital? It is very dynamic. It keeps on changing from moment to moment. When a patient goes to ER, his expectations are good doctors, good nurses, equipments and treatment and relief of pain and all that. When they go to ICU, it is expected length of stay and communication and all that. When they go to ward, it is number of TV channels, the type of cutlery and the discharge time and all that. So it keeps on changing from time to time, so we need to be so sensitive about it. So what do patients expect? Broadly, what they know is structures. As you go down the list, it is more and more subtle, but more and more important probably. So probably the last one, ethics, which is probably not visible in hospitals as well as for the patients. So I want to share this experience, which is elaborating on ma'am's experience of what they're doing in Kerala. This is, we called it as Project Hello. The whole purpose was, after the discharge, it is the follow-up and calling by the doctors, not by guest relations alone. We tried different methods. So to find out how they are doing, to clarify if there is any confusion, follow-up date and all that. So we had a debate, who had to do it? Is it the doctors, or is it the nurse, or is it the guest relation? So to give a fair chance to everybody, we tried everything. So around 1,000 calls were, this is for the research purpose I am putting this slide. Around 1,000 calls were made by doctors and guest relations. Doctors would do the doctor's part and the guest relations their part. Then the nursing and guest relations and only guest relations. All were comparable, like 700, 800 and 1,000. So the doctor's call was mainly focusing on the pain management, medication reconciliation, even it modified the advice when they have to come for follow-up. It changed so many medications also. The nurse's call was, both were provided the discharge summary when they had to call the patients. It was reiteration of the discharge advice. Again, when there was a clinical question, nurses told, I will get back to you after clarifying with the doctors. And GR call was more focused on their problems and how was their experience and if there is anything they could help. So those were the types of questions. So we captured the delight factor when the patient told during the phone call, oh, thanks, I never expected this from you. So it was very nice to get a phone call from the doctor. We tried it with the surgical departments initially. So the delight factor which was expressed by patients when the doctors called, it was 75%. They verbally told that, oh, you're great, thanks, you called me. When the nurses and the GR called, it was around 55%. When the GR called alone, it was 65%. This was surprising to us. At least we thought that doctors may be first because they never expect a surgeon to call, would call after the discharge. But problem was, probably we told that the nursing supervisor should call, not the person who had rapport when at the time of admission. Probably that was one mistake. And the second thing was, nurses probably were not empowered enough, so that they always told that I will get back to you after checking with the doctor. Even if it was a small thing like increasing paracetamol 1 tablet to 2 tablets, they always told that we'll get back to you. Probably that was the difference which made. But overall, it was a good experience, and these how many ever patients got delighted, they were really delighted, and which was a wow factor. So we thought that GR plus doctors was the best combination, GR plus empowered nurse would be the second combination, and GR alone would be the third possible combination. So for whole of the hospital, we have to strategize and we have to stratify according to these different groups. It was not possible to do it only with the doctors. So this is the plan. Now I want to share the story. So I just did a mini research on WhatsApp, non-informal research. I asked my non-clinical friends, non-doctor friends, apart from the clinical outcome, what is the most important thing you care about hospital? Are you worried about a hospital when you have to visit a hospital? It was 90%. It was a shock that they told that the hospital may cheat us. We get worried that some unnecessary investigations and treatment might happen. So now I want to tell a story. Names have been changed for confidentiality reason, but it is a real one which happened in our own hospital, my hospital, Baptist Hospital. Mr. Dayal, a successful NRA businessman, gets admitted to hospital. Admitted, this was around 8 years ago. He got better after 5 days, very happy with the nursing care. He offered 5,000 rupees as a tip to one of the nurses, but she told, no sir, I can't accept this. Probably this was almost the salary of the nurse at that point of time. But if you want to donate, I can, can donate it to Poor Patients Fund. I can provide the receipt. He was surprised. He offered the same tip to another nurse in the next duty, in the evening duty. The same answer. He was more surprised. So he wanted to meet the CEO. So this ethics I am trying to build in my organization. How did you achieve it? He was very pleased and delighted about the hospital, and he decided to give some donation to the hospital. So some donation was given, 2.5 lakh rupees per month for poor patient care forever. Now it is running. Not just that, it was around 4.75 crores to develop the hospital infrastructure. All this happened because of the ethics and the attitude of two nurses who worked. So what I want to conclude is, unfortunately, ethics has become a delight factor. It should have been a basic factor which should have been there, but it is a delight factor. So need of the hour is ethics. Empathy will automatically follow when ethics is there. But even if ethics and empathy is there, we need to learn how to communicate the empathy and the ethics. Probably the only things patients care for is I care attitude. Thank you very much.
Simply wonderful presentation by Dr. Badari. In fact, I had prepared to speak a few sentences. I am awestruck at the narration made by Dr. Badari. Simply fantastic. Please give him a big hand, ladies and gentlemen. And the purpose of every presentation being made in this 2-day session is to ensure that each one of us imbibes a certain amount of ethics, that we will be able to replicate what has been done here in every day in our life. And to sum up what has been said by the two speakers is that if you are able to elicit a wow response from each patient who comes to your hospital, he will go delighted and you will be blessed. It is not an easy job, because to achieve this, at every moment of your work in the hospital, you have to be at your best, which is not that easy. And the response is, if to elicit this wow factor, as the first speaker made a reference, it has to be right from the person who manages the valet parking to the consultant. Everybody involved and every point of contact which the patient comes in with in the hospital has to be at the highest level, not only in ethics, but also in performance. I think it's a fantastic capping for today's presentation. Thank you, ladies and gentlemen.
Good evening, everybody. I'll not be taking much of your time. So dinner will be starting at 7:30, and tomorrow we'll be starting our conference at 9 a.m. sharp. So request you to all to be on time. And we are conducting a survey on impact of accreditation on hospitals and laboratories. So the survey forms are in your delegate kit, and those who haven't received it, they may get it on the CAHO counter, which is there in the exhibition area. So request you to fill the form, and there are two lucky respondents will be getting the mobile phone. So request you to all to fill the forms and submit it at the CAHO counter only. And tomorrow evening we'll be announcing the winners. And we'll be having our governing committee meeting and in the lobby in the hotel. So request all the governing committee members and the organizing committee members to be there after this conference. Just like now we can move towards the hotel lobby.